Welcome to Working Smarter, Concise Compliance Conversations featuring Wendy Rubis, sponsored by VillageMD, primary care physicians. Practice medicine the way you've always wanted. Data, resources, and clinical decision support to care for your patients inside and outside the exam room.
Hi, welcome to Working Smarter. This is Janessa Nelson, the Senior Legal Analyst, and I'm joined today by our Director of Revenue Cycle at VillageMD, Kristi Lee.
Hi, Janessa. How are you today?
Good. How about you?
Great. Happy to be back with you and talking some more compliance.
Yeah, and we got a great topic. It doesn't seem difficult, but a lot of people are confused because there's a lot of requirements that are needed, and a lot of people misuse it. So we're going to talk to you about Incident 2 billing today.
And Incident 2 billing is definitely a hot topic with the OIG. It's always on the top 10 list. So knowing what the rules are is critical to success.
Yeah. So just to start off, what is Incident 2 billing?
So Incident 2 billing is really the definition as any service performed by an advanced practice provider, which is a nurse practitioner, physician assistant, that kind of type of provider. And they work in the physician office treating patients. And as long as they're following the rules that we're going to talk about today, they can actually bill under the physician's name that's in the office with them and get paid 100% by Medicare.
Wow. So, I mean, there's a lot of benefits to that, right? But I think one of the main big requirements that we're going to highlight is that the physician has to be in the office. It doesn't mean that they have to be looking over your shoulder, right?
Correct. They don't have to be in the room with you while you're performing the service, but they do have to be physically present in your clinic.
And is that for like a physician you work with all the time? Can it be for different specialties?
Mm-hmm. Yep, it can be for, a different specialty. It doesn't have to be, the same specialty as you. It doesn't have to be the physician that actually developed the care plan. It just needs to be a physician that's under your tax ID number that you bill under. And as long as they're in the suite with you, you can bill under their name.
Wow. Okay. So let's get a little bit more information because it's not that simple, right?
No.
What I'm seeing here on the screen is one of the benefits is that you get reimbursed 100% for Medicare, right?
Correct. So they're paying you just like they would have paid the physician for rendering that service.
So let's look at the requirements of what exactly you need to have in order to bill this Incident 2.
Right. So billing Incident 2, you have to first have an established patient.
So not a new patient.
Not a new patient. Mm-hmm. It's got to be an established problem.
Can it be an exacerbation of an established problem, or it has to just be?
It can be. So they could be coming in, for their diabetes, and now they're actually having maybe their A1Cs are a little out of whack, so they're needing some additional treatment for that. So it can be an exacerbation. It doesn't have to be the exact same diagnosis, as long as it's in the same family.
Okay. Mm-hmm. What happens with the exacerbations for the existing plan of care? Can you sort of like alter it a little bit, or do you have to exactly stay within the plan of care?
Yeah, so you can follow that plan of care, and then you can make the alteration. Maybe you needed to change the medication for them, and then you want to make sure that if you're doing that then you follow back up with the physician. So their next visit coming back in, you want to make sure they schedule with the physician.
Good. And then once again, let's emphasize the supervising physician is in the building.
Yeah. And you are, like we talked about, working off an existing plan of care. So the physician had to initially see that patient and develop that plan of care, and then you're now following it.
Let's just talk about things that you can't do when you're billing Incident 2, because this is where a lot of the confusion comes in. Mm-hmm. So a new patient, not okay.
Not okay. No. It has to be seen by the physician first to get an established plan of care.
And if, let's say, we have a plan of care for their diabetes, but they're coming in now for shoulder pain, is that okay?
Not okay. So that's a new problem, and you're going to address that new problem, and then you will bill under your own name and be reimbursed at 85% of the Medicare fee schedule for that.
And then what happens if they're coming in for an AWV, IPPE, anything else that's preventative care?
Right, and that's always a big issue. Most people do not realize that when they're coming in for preventative care, like your annual wellness visit, that is a totally different benefit category under Medicare. Mm-hmm. And so if your nurse practitioner or physician assistant is providing that service, they need to do direct billing for that. So they would bill under their own credentials to Medicare.
Yeah, and the other thing that we want to emphasize is because the supervising physician has to be in the building, you can't bill incident to in nursing home, outpatient facility, or in the home, right?
That's correct.
Yeah, because they have to be in the building.
Yep. So like in the patient home, which we do have Village at Home now, right? You cannot do incident to billing in the home unless the physician's actually in the home with you.
Yeah. One of the other major things is trying to bill incident to for diagnostic testing, right? So
Right. Yeah. So if you're doing any diagnostic procedures like x-rays or ultrasounds, those need to be direct billed by whoever rendered the service. So they would need to bill under their own credentials.
And then the other important thing is the 50% of the visit is spent on counseling or coordination of care. You cannot bill for incident to.
Right. You would bill under your own name. And of course, there too, you're billing based on the amount of time that you're spending during your E&M. Make sure you're following your E&M guidelines around making sure you've documented properly what counseling you did and the amount of time spent.
So let's just review those one more time. So if the physician's in the office,
Physician's in the office, it's an established patient with an established problem, and you're working off a care plan that was already put in place from the physician visit.
and if you don't have those things, you can't bill for it. You have to bill
Right.
under your own TIN.
Yep. Even if you have 3 of them, you still have to have them all. You have to meet every one of the criteria.
Well, that's very helpful to know. At VillageMD, we try and be compliant with all federal and state laws. And so we want to make sure that our providers are being as compliant and billing properly.
And then if they have any questions, feel free to reach out. We're happy to answer them.
Yeah, and you can see on the slide Kristi's email in case you would like to contact her directly about any billing questions or any concerns that you have. It's klee@villagemd.com. Thank you so much for joining us, Kristi. It was really helpful.
Yep. Thank you. Happy to be back.
Thank you to our sponsor, VillageMD. We hope you will join us for future concise compliance conversations.